Did you know that sight can be restored using one's own tooth? This rare and complex procedure is called the Osteo-Odonto-Keratoprosthesis, or OOKP, also known as tooth-in-eye surgery. Here's how it works. A small piece of tooth and surrounding bone is removed, shaped, and fitted with a tiny optical cylinder to create an implant. The eye is then prepared for the implant, which is subsequently placed into the cornea, creating a new pathway for vision. OOKP is usually reserved for people with severe corneal blindness, especially when conventional transplants or grafts have failed. Conditions such as Stevens-Johnson syndrome, ocular cicatricial pemphigoid, or chemical burns are some examples of indications for candidacy. Surgery is performed in 2 stages, spread over several months. Recovery can take between 4 and 8 months. The outcomes are often life-changing, but there are risks, such as implant loss, infection, or glaucoma. That's why strict follow-ups and even oral hygiene care are essential parts of life after surgery. All things considered, tooth-in-eye surgery represents a remarkable advancement in ophthalmology, helping restore vision in situations where standard therapies often fall short. To learn more about the long-term outlook, recent advances, and other details, read the full article here.